For my community assessment, I decided to do the town of Weymouth, where I've lived for the last 23 years. Some facts about Weymouth. It's a small town 20 minutes to South Boston. It's the second oldest town in the Commonwealth of Massachusetts, originating in 1622. 56,000 people live here. Places of interest, right when you come off the highway, you come into Weymouth Landing, where it has a lot of new restaurants, shops. It has new high-rise apartment buildings, which are bringing a lot more people into the town. And it also has the commuter rail run right through it. Columbian Square, where South Shore Hospital is. Wassagusset Beach, and the Naval Air Base. So some modes of transportation that most people use. People that are traveling into Boston for work use the MBTA commuter rail, which is the Green Line, which started in 2013. We also have the MBTA buses, which run through the landing. Uber and Lyft, which are very common now, and just people using their personal cars. Education, we have a lot of schools, a lot of public schools. Weymouth High School, which was redone in 2004, which is that picture down there. Academy Ave Primary School, Murphy Primary School, Pingree, Ralph Talbot, Wassagusset, and Seach. And then we have our private schools, Sacred Heart School, which I went to, South Shore Christian Academy, and St. Jerome's, which are all K through 8. Our health facilities, we have South Shore Hospital, which is really the only hospital in the South Shore that has 24-hour emergency room and is a level 2 trauma center. We also have the brand new Dana-Farber Cancer Center, which is nice because our patients in the community who have cancer don't have to travel to Boston for appointments. We have our Health Express, which is our urgent care center, which opened, I believe, in the last couple of years, which has definitely decreased the amount of people going into the ER. For shelters, we have Friends of Homeless in the South Shore. And then the last 3, Brooks Retreat, Brady's Place, and New Hope Transitional Support Services, are for people with substance abuses in halfway houses. So the priority problem I chose for my number 1 problem was suicide. It may not be the number 1 problem in Weymouth, but when I was in middle school, there was a couple of children that had committed suicide, so it's pretty important to me. From 2005 to 2015, 39 people committed suicide in Weymouth alone. Besides Quincy and some big towns in the South Shore, Weymouth is pretty up there with their suicide rate. This is due to bullying in schools. After doing my research, I realized that Weymouth also integrated the SOS prevention program into the schools, which is a sign of suicide prevention program. It's the only youth suicide prevention program that has demonstrated an improvement in the students' knowledge and adaptive attitudes about suicide risk and depression, as well as a reduction in the actual suicide attempts. With that, I do believe that kids in the schools need to be watched more closely, just to watch out for those early signs of depression and suicide. My priority problem number 2 is the opioid crisis. This is a big problem pretty much in any town. In Weymouth, in 2017, the number climbed. There were 28 deaths, and that upped from the year before being 25. This is also a pretty important issue in my life also, because my cousin, who's not even from Weymouth, overdosed and passed away in the town of Weymouth. So the issue with this is there's definitely an over-prescribing issue. In the hospitals, patients go in, they're prescribed narcotics, they go home, and then they end up abusing them and starting other stuff like heroin. Then they go into the rehab, where they're there for maybe a month to 30 days to 3 months, depending on insurance. And then they go back in the community trying to live a normal life, and that's really where they need the more support. Some of them don't want the help. Some of them like to go to meetings. But realistically, if they're going to be coming out of rehab, they need a counselor or something to keep them on the right track. It's just a never-ending cycle of overdosing, going back to the hospital, and then overdosing and potentially using the wrong dose and dying. So my plan was to prescribe the patient with Suboxone, which usually that's the case, monitor the patient closely in the community with a personal counselor, in mandatory meetings, and offering support groups for these people who fight addiction. And these are my references.